Good morning, Miss Smith. I'm Diane. I'm from the lab. I'm going to get some blood from you today. Can I get you to spell your last name?
SMITH.
And your date of birth?
7/19/61.
Okay. Let me see if I can find a vein first. We always want to feel for the vein instead of just look for it, because sometimes the ones you can see aren't always the best ones. In children, we're going to stay in the antecubital area if we can, but that's not always possible. When we have to go to one of the smaller veins, either in the arm or the upper arm or the back of the hand, we're going to use a butterfly instead of a regular needle. I think I'm going to try this one today. The butterfly is nice and convenient, but it doesn't always give us the best specimen. When we're going to do a hand stick or a very small vein, we're going to attach this to a syringe, and this piece just comes off and the syringe screws on. But when we're using a vacutainer with it, this piece stays on, the little plastic comes off the back, and it screws right into the hub. You don't want to take the cap off of the butterfly until you're ready to stick. We're going to put on the tourniquet. We want to make sure it's on for no more than 2 minutes. Wipe the spot in a little circular motion, and you can either let it air dry or wipe it with a piece of clean gauze. The butterfly is named that because it has these little wings. You can either hold the wings together like this to do the draw, or some people will hold it like this to do the draw, whatever's most comfortable. The nice thing is that you can leave the hub lay on the counter and you don't have to have your hands full. We're going to make sure it goes parallel to the vein, just like always. There's going to be a little stick. And it's nice because you can see the blood come up into the tubing to know you're in there. Then you can just leave the needle hang there, and a lot of people think that looks funky, but that's the way it works. You put your tube on. A lot of times I hold it down to let gravity help it fill. Once I have blood in the last tube, I can release the tourniquet. Take off the tube, invert it a couple of times to mix the anticoagulant well. I can lay this back on the counter. I'm going to put gauze over the needle, pull out, then push down. I'm going to ask my patient to hold that for me, please.
Sure.
Many of the newer butterflies have a safety feature where you can just snap something or push the cover over the needle, but this one doesn't, so we're going to make sure we're very careful putting it into the sharps container. We're going to make sure the bleeding has completely stopped. Would you like tape or a Band-Aid?
I will take tape.
We want to make sure that we tape it down nice and tight so it puts a little bit of pressure on there. One of the other nice things about the butterfly is if your patient is very wiggly, like a child, it's a lot easier to control it. Okay. And we're going to take the tube and label it before the patient leaves. Can I get you to spell your name one more time?
SMITH, Mary.
And your date of birth?
7/19/61.
Thank you, Miss Smith. You have a very nice day.
You're welcome.